Today, I'm going to start a new topic. Very good evening to one and all. The today's topic name is personal protective equipment, and the simple way you can call it as PPE, personal protective equipment. Okay, the name itself here, the meaning of that PPE is so personal protective. That means we have to take care about our like physical body. Like already I told you in the day one class about the PPE, but that is only for the introduction class. And now today's class is about almost what are the subject is coming under PPE, what are the topics and what is the equipment, what is the like all personal equipment is coming under PPE. Then you can see in the right now classes, present classes. Okay, yeah. So what is the use of PPE? What is the use of personal protective equipment? A variety of barrier to protect HWS, mucous membranes, airways, skin, and clothing. So that is called PPE. అంటే మనకి మన బాడీకి బయట సైడ్ ఎక్విప్మెంట్ ఐ మీన్ అట్మాస్ఫియర్. ఓకే, సో మనకి బయట సైడ్ ఎక్విప్మెంట్ ఉండడానికి ఒక మధ్యలో ఒక బ్యారియర్ ఇది అడ్డు పెడుతుంది అనమాట, ఆపుతుంది. సో దట్ ఈస్ కాల్డ్ యూజ్ ఆఫ్ ద PPE. ఇప్పుడు మనకి ఈ ఏంటి ఈ PPE వాళ్ళు వేసుకోవడం వల్ల మనకి యూజెస్ ఏంటంటే మనకి అక్కడ కంపెనీలో లేదంటే ఒక మ్యానుఫ్యాక్చరింగ్ యూనిట్ దగ్గర మనం ఉన్నప్పుడు మనం ఏమేమైతే ఇన్హేల్ చేస్తామో లోపలికి పీల్చుకుంటామో అవి మనకి ఎలా వెళ్తాయి? త్రూ నోస్. ఓకే, సమ్ టైమ్స్ through the body skin, because of our body skin act as a membrane and skin and the clothing, and sometimes you can have fluids, body fluids, splashes. Like these are all commonly you can't affect when you are using the PPE. So that is the use of PPE. Yeah. And what's coming under the use of PPE? Suppose, let us take one example, gloves. So when you are touching the body by the different units, like see blood, body fluids, secretions, excretions, contaminated items. So when you touch this one, so that is directly contact with our skin, body skin. Without, if you are, suppose some chemicals will be there, when you are unfortunately you are contact with that type of chemicals, what will happen? The skin will burn, and sometimes the fluids will go into our body, inside the body through nervous system. So because at that time of, then instead of that, these are all problems, you can use simply gloves. Already know the meaning of gloves. So by using the gloves, you can touch anything on the working area. So because almost there is some whatever that you touch that, so that is only touch with gloves only. So because so there is no problem at all in that situations. Okay, next, the second one, gowns used during the procedures and patient's care activities when contact of clothing, exposed skin with the blood, body fluids, secretions, excretions is anticipated. Okay, so now so these are all suppose if it is regarding patient, when you are working in the company, suppose unfortunately there is a spillage of liquid or there is a leakage of liquid, then suddenly it can spill that. At that time you can use the like aprons, then that you call as gown. Okay, so that is also a second type of PPE. Third one, mask, goggles, and face shield. So these are used in the process of the any situations. So then that can protect whatever the liquids, whatever the chemicals that's not goes into our body. Okay, then you have to take care about like whatever the chemicals, whatever the fluids, if it is like a spillage of that, then that is not directly contact with the eye. Because of that, you are using the specs. So Google's nothing but specs. And face shield. When you know about these face shield in the corona time, you can use the shield, so that the shield completely protect our skin and eyes, nose, mouth, like whatever it may be the situations that is, and you can cover. Yeah. See, so this is the gown, and there is some procedure how you have to remove, how you have to wear like that. Okay. Select appropriate size, type and size, because different humans have different measurements. So somebody has small, somebody has medium, somebody has a large size, XL size. So based on that size, you can select. Okay. So then it can covers at it can covers our arms, body front, neck, and mid thigh. So, and that is one type of the like gown, or it may be aprons like that. Secure at neck and waist. So it can secure at neck system and also at the middle of that waist. On the waist, nadum దగ్గర matter waist. And if gown is too small, use two gowns. So that ties in front and ties on front నుంచి కట్టుకున్నది, back నుంచి కట్టుకున్నది. So దాన్ని gowns అంటారు. Okay. Yeah. How you can remove the gown? Unfasten and ties. అంటే మనకి కట్టిలా లేకుండా ఉండేది. Next. Uh, peel gown away from neck and shoulder. Turn contaminated outside the towards and inside. Fold or roll in the bundle or discard. So that is the procedure, because when you are using the gown, because if any chemicals is fall down on the gown, so that then you have to remove in a particular situations. And third one, mask. And we have a different mask, like surgical mask, like N95 mask, like normal mask, like cloth mask. You have a different mask. Okay. And coming to the surgical mask. So it can protect the patients or the workers or whatever it may be for the respiratory system. Respiratory, nothing but lungs, nose, like whatever you are inhaling the things. So that is coming under surgical mask. That is a indirectly coming under a respiratory system. Placed on coughing patients who are the getting coughing. So then you can put that for the particularly for that patient system. And the procedure that generates classes and sprays. How to done a mask, then how to put a mask. So place over the nose, mouth, and chin. So you have to cover three parts. You have to cover three parts. Further, these type of surgical mask. What is the three parts? This one, nose, and then mouth, and then chin. Okay. And what is the use of closing the nose? Because of whatever you inhaling outside the system, respiratory system through nose, by holding the nose, because it can covers the nose. Second one, mouth. So mouth also you have to close that, because of sometimes without overflow of the air, then you can smell it or you can face it. Next, chin. Because for the tying system, you can use the chin. Next, flexible nose piece over the nose bridge. Secure on head with a ties and elastic. And N95 respirator. Because you have a different masks. You already know that in the corona system, N95 is nothing but one type of a highly secured nose mask. Okay. And fit flexible nose piece over nose and bridge. Secure on head with elastic band. Perform on a seal neck, because when you are inhale, or respirator should be collapsed. When you exhale, check for leakage around the face. Because of that, N95 is a very secured mask in the particularly who are facing the some severe respiratory systems for that, or employee or patient, whatever it may be. See, For airborne precautions, what is the meaning of airborne? When the in the oxygen, you don't know exactly what are the mixed with the particles like uh, different particles through these particular air. So that is called airborne precautions. So you have to well sealed check. So done every time you are wearing N95 respiratory system. So see, so this is the, it can completely covers throughout the, that means there is no any leakages or there is no any airborne precautions for that one particular. Next, fit test. Fit test nothing but what? How, yeah, the whatever the gown, mask, like whatever the PPE equipment, personal protection equipment, how it can fit to the particularly employee or worker, whatever it may be. Because without knowing the fit test, you can't wear, because of sometimes you can have a what do you call that? Small or large, sometimes XL type. Because of that, perform manually, because it can conduct each yearly once. Each staff should be aware of that fitter test, because you know the type and the size, which type of material totally you are working on the conditions. Based on working conditions, you can select the material and also size. And removing N95 mask in a particular way, lift the bottom elastic. See, you can see the in the diagram, and from the back side you can remove like that and over the head first, and then lift off the top elastic and you can discard. So that is the three simple steps to remove of the N95 mask. First one, lift the bottom elastic, because you have a two different elastic rubber bands at the back side, and you can remove first one and then remove the top, so that then you can remove the N95 mask. Yeah. So you should remove N95 respirator just outside the patient room, whatever it may be, because you can't remove the N95 mask within the working area. So then once you are going, when you are coming from the particular situation or area, then you can remove the N95. And next one, eye, for the eye protection, because when you are compared to all the parts, human body part, so this is one of the important part for the human body, that is called eye. So then positioning goggles over the eyes and secure the head using the ear pieces of head. అంటే చిన్న చిన్నవి ఉంటాయి ఇలాగ మన ఇప్పుడు మనం ఏంటి ఇయర్ బడ్స్ వాడుతున్నాం కదా, మొబైల్ ఎయిర్బడ్ అలా ఉంటుంది అనమాట. జస్ట్ యూ కెన్ పుట్ ఇన్ సైడ్ వాట్ ఎవర్ ద వైబ్రేషన్స్ ఆర్ నాయిస్ పొల్యూషన్, you can't hear that much of the sound, because you can. Okay, next, second, position face shield over the face and secure and brow with headband, because ఈ headband నుంచి పైకి పెట్టుకుని ఇక్కడ సిన్ వరకు ఉంటుంది అనమాట. ఇది ఫేస్. అండ్ ఇఫ్ ఇట్ ఈస్ ఏ స్పెక్ట్స్ ఆర్ గూగుల్, సో దట్ మీన్స్ గూగుల్స్, సో ఐ గూగుల్స్, then you can put here. It can protect all over the eyes, not only directly. If it is a chemical is fall down on our head, so even also it can't go into the our eyes, because of it can protect over the top of the eye and also from the bottom of the eye. So then these type of goggles you can use in the industrial areas. Yeah. And gloves used in the direct contact with the fluids. Already you have a discussion in the previous slides. So if you are direct contact with the blood, body fluids, in that time, our skin, in that time you can use the gloves. Dealing with the patients under contact isolation, put in the first PPE to the remote. So these are the gloves. Yeah. How to safely use PPE? So already knows the different equipments for the personal protection equipment. That, but how you can use? Keep gloved hands away from the face, because you can use the gloves, because while working area condition. So sometimes you can use like that, or sometimes you can doing like that. So that is also not good thing. Because of that, already some of the chemicals may be touch with these what is that gloves. So on the time it's very dangerous to the human body. Okay. Next, avoid touching or adjusting the other PPE. Because you can adjusting like gloves, mask, or ground, whatever it may be. So don't do that because sometimes you can use a like irritating system. Sometimes you can use a different. So because don't use that system, and remove gloves if they are become torn. ఎప్పుడైతే చిరిగినట్టు ఏమైనా ఉంటే then you can remove the gloves. Perform head hygiene before doing the new gloves. So then you can hygienically, you can neatly proceeding process, then only you can go for the new gloves. Okay. Next, limit surfaces and items touch to avoid contamination. Limit గా ఉండాలి surfaces ఎక్కడ టచ్ చేయకూడదు and avoid contaminated ఒకదాంతో ఒకటి contaminated టచ్ చేయడానికి ఉండకూడదు. Okay. So this is about today's class, how to use the PPE. And one more thing, so this is the last class. Almost we covered around safety in the production, almost all topics, because of when you are dealing with different equipments. So again you are అంటే మనం ఇది విన్నాం కదా, ఇది కలిసింది కదా, ఇది వచ్చింది కదా అన్నట్టుగానే ఉంటుంది. ఎందుకంటే ఆల్ ద ఎక్విప్మెంట్స్ ఒక దాంట్లో వచ్చింది, ఇంకో దాంట్లో వస్తుంది, ప్రొడక్షన్లో వచ్చింది, మెయింటెనెన్స్లో వస్తుంది, మెయింటెనెన్స్లో వచ్చింది, క్వాలిటీలో వస్తుంది, క్వాలిటీలో వచ్చింది, యాడ్లో వస్తుంది. సో బికాస్ యూ హ్యావ్ ఏ different equipments in the different conditions, but all are in a single manner, that is called in the industry. So from today is the last class, and we are almost we are completed like internship classes on the production safety in the production classes. And you have, I think, one more this one assessment test. It consists of 25 questions, maybe a Saturday or next week, and you can write the exam. Okay. So this is about today's topic. If you have any doubt, you can ask me. I will give a reply. So most of the people, Komalika, Parimala, Pujita, Batula, Sudarshna, చాలా మంది జాయిన్ అయ్యారు ఆల్మోస్ట్ అన్ని క్లాసెస్కి. కొన్ని మధ్యలో క్లాసెస్ డ్యూ టు సమ్ టెక్నికల్ ప్రాబ్లమ్స్ మిస్ అయ్యాయి. బట్ ఎనీవే వీ హ్యావ్ ఏ క్లాసెస్ ఆన్ ఓషన్ యాప్స్ వెబ్సైట్లో ఉన్నాయి వీడియో లెక్చర్స్. దెన్ ఎప్పుడైనా మీకు వినాలనుకుంటే కూడా వినొచ్చు. ఓకే. ఎనీ డౌట్ రిగార్డింగ్ దట్?